Millions of dollars are coming to Iowa to address the mental health of children and teenagers. This comes as data show 1 in 10 high school students in Iowa has attempted suicide. KCRG TV9's Emily Sherrod talked to mental professionals. So Emily, how did they say this money will reach more kids?
Yeah, Beth, the more than $2 million grant renewal will allow University of Iowa hospital clinics, University of Iowa Healthcare, that is, to expand, but also give them the opportunity to collaborate with UI Scanlon Center for School Mental Health, getting care directly into schools.
It's become more of a medical issue and less of a taboo issue that people are more willing to talk about.
Most children in Iowa don't have access to a mental health professional close to where they live. That's a barrier a federal grant extension aims to address through the University of Iowa Healthcare and Scanlon Center for School Mental Health.
We have previously had this award for 5 years.
The renewal will mean more doctors and nurses who see kids for their well child checks will get training to treat mild to moderate mental health concerns.
So building that workforce, so when a child is identified with a potential mental health issue, they don't need to travel to Des Moines, they don't need to travel to Iowa City. They can be, those issues can be addressed in their community.
The funding will also allow children and teens to access mental health care through telehealth, which is notable since federal data shows 42% of Iowa children with high mental health needs have problems accessing service.
One thing that's really unique about our clinic is that we provide services in the school setting.
One of those in-school services is sending in a team after a crisis at the school. Ford says that includes things like sudden deaths or natural disasters.
We're able to kind of come in after that initial crisis response and provide ongoing support, bringing counselors and therapists, and we're able to do that in person and virtually.
Dr. Scholl says as they continue to expand and more people understand and have access to treatment, the more destigmatized mental health care will become.
This is like having a sore throat. You need to treat it just the way you would pneumonia, and it's not something that you need to avoid. It's not something you should hide. It's not something you should put in the back room, but it's something that really should be walking through the front door and saying, yes, now's the time to treat it.
In Iowa City, Emily Sherrod, KCRG TV9 News.